Hi, this is Erin Kershaw with Brandywine Elder Care Management. I am very pleased to be here today at the Caron Treatment Center for older adults. They have a special program, and I'd like to introduce Sharon Matthews, the clinical director of the program. Most people are probably not aware that Caron is here or even what they offer, so I thought it was very important for our viewers and their family members to hear right from the clinical director what this program is about. And we will include on our website and via our email in the contact us form, we can share any information and get you to the right people if you have questions. So Sharon, thank you so much for taking the time to talk with me today. Could you take just a few minutes to tell the audience about this program here?
Surely, and thank you so much for having me and getting the word out, so to speak. This is a most important and very passionate subject for me now. I've been doing this older adult program since 2015. That's when we opened, and since then, we've now treated 645 older adults, starting in a 10-bed unit. Now we have 15 beds, and certainly we could use more than that. The increase of older adults needing addiction treatment is what drove us to do this. We also knew that they needed to be with their own age group, so to speak. It's 55 to 90. And what we know is they have the commonalities. They've had jobs, they've had lives, they've had children, they've had grandchildren, they're now maybe retired. So the components, as people age, first of all, you have the grief and loss just normally, but then when you add those other factors to it of retirement, maybe a co-occurring issue such as chronic pain, that type of thing, people tend to medicate, and we call it chemical coping. They medicate with pills, alcohol, or whatever. Alcohol is still the prevalent drug of choice, and then right underneath that is benzodiazepines, which people go to a doctor, I can't sleep, and then they give them a sedative. Benzos in older adults certainly do not mix and should not be taken and consumed by an older adult. And then opiates, of course, for the chronic pain issue. So that's how we started it and the reason we started it. And so this is a very interdisciplinary approach. It's not just about clinical, it's not just medical, but it starts with medical. It's all about safety first. And so our program, the layout we have here, every room is ADA compliant. Everything is delivered in this building. We have the doctors on the first floor. We have physical therapy on the first floor. We have groups in the lower level. Everything's accessible by the elevator. And the dining room is on the first floor, very beautiful area as well. And then we are the only ones who have nursing 24/7. So there's always somebody here to take care of them. And then the psychological piece is important as well, because as people age, again, the cognition might be impaired normally, but then if you add a chemical to it, alcohol and the benzos really impair our older adults. So our psychologist will give them an assessment early on. It's called the MoCA, Montreal Cognitive Score.
Yes.
And 30 is normal. Under 26, you're starting to be impaired. We've had them as low as 2. And when they're down to 2, oftentimes that means it's quite impaired and maybe not coming back. She will retest them in 3 weeks, and then it could be that they improve. Most times they do improve. Sometimes anxieties get in the way of that because they're already fearful that they're going to maybe fail. This is much of an achiever kind of crowd because of the successes they've had in their lives. So along with that, the spiritual piece, because of the grief and loss, because of the fact that maybe now they have lack of purpose. What am I going to do now? I'm retired. My kids are out of the house. I don't know what to do with myself. So we also, our mantra is quality and purpose of life. That's what we're trying to give them as they go through treatment. And the beauty of this unit is the fact that you can literally see them come back to health. We get them on wheelchairs, walkers, canes, and then by the end of treatment, they're walking on their own. And that is a direct result of all these disciplines I talked about, and especially the wellness team. We have a wonderful wellness team who come here every morning at 9, and they get them moving, whether it be chair movement, that kind of thing. They also have access to the gym every day. And once they get started, they want more of it. Most people come here because of the leverage of the family, I will be honest, because the families are seeing something go awry, and they don't know what to do with it, and they get frustrated, concerned, and angry, and then they start Googling actually addiction treatment for older adults, and Caron pops up. And then they'll contact people like our RDs, the regional resource directors, and say, what is it that you can offer? And we do a lot of upfront calls. We will talk to the families. We've done it. Dr. Wang and I do it weekly, where we have to alleviate the fears, because it's pretty scary to come to a place that you know nothing of and give up your, so to speak, freedoms and be in treatment, I always give them props for the fact that it takes a lot of courage to come to treatment as an older adult.
It does.
It really does.
To admit
Yes.
that you
need help
you
first.
need the help.
Yeah.
How long, and maybe this is an easier or difficult question to answer, how long is someone typically here in the program?
That is an easy question.
Okay.
We have a minimum 6 weeks length of stay because we need it. We need every bit of that. Most treatment centers are 4 weeks length of stay. You move on to continuing care. They are slow out of the gate. So number one, the first whole week, they're trying to get adjusted and go through the withdrawal process. And then that last week for sure is all about what's next. Are they going back home? Is it safe to go back home? Do they live alone? Are they going to get to therapy? Are they going to be able to be on their own period and get to meetings? So that factor takes quite a bit of time. And then are they in fact going home at all? Do they need assisted living? So that is the 6 weeks length of stay, and the families need as much time as they can get. Families feel relief after they get here, going along through the process. They get educated on a family program, and then as you're getting ready to discharge a person, once again, they are a ball of nerves and worried, oh my God, is this going to work? Now they're coming back to our environment. Now what are we going to do? So we always encourage them to do their own education and support groups as well.
And even though we're here in Pennsylvania, you do treat people from outside this area, correct?
We treat people from everywhere. I have somebody from Florida right now. We have many people from Atlanta. We have people definitely from New York State, not just New York City. The Midwest is a hot topic right now. Missouri, Michigan, sometimes Kansas. I've treated people from Alabama, California. So the word is out, and that's a good thing.
And it's good for all of you who are watching. You may live locally, but have family members or friends who could benefit from this program. So the good news is this could be a viable option for anybody who needs this. And the fact that they have this particular unit for older adults does make it valuable and unique compared to other options that are out there. So let me ask, if a family member is concerned, their first step is calling here.
First step is calling, and admissions would walk them through what we do, how we do it, give them the ins and outs of that. If they need another call, then oftentimes they will attach them to Dr. Wang and I. He is the medical director. And then we walk them through exactly what treatment is like, because they want to know day to day, what are they going to be doing, how are you going to take care of my loved one? Before COVID, we would even have family members come in and do a tour. That's going to maybe open up a little bit, but COVID, if you talk about COVID, it really created quite an impact. We kept going business as usual every day. It did not lower our census at all. And what we did see is that it increased, increasingly they were more compromised. COVID, what it did is isolate people. It caused people who maybe were in recovery to relapse for the fact that I don't like Zoom, I don't like going on the computer, I feel disconnected, so it's all about connection. And they would use it as the reason. Basically, that is one of the excuses to use. However, it did cause a lot of heavy duty, I would say physical problems. People are coming in much more late stage alcoholic, even at a younger age. As I said, my ages are 55 to 90, but I have a person here right now who's 42. And it really depends on how they are medically compromised or cognitively.
And with COVID, as all of you well know, we all felt isolated. We all felt that our ability to be and communicate with other people was so compromised. So when you add into that somebody who may already have some cognitive decline, who may have some mobility issues, fear of COVID and what that would be like for them, all those things come together to just create the perfectly bad environment for this to accelerate on a very quick basis. So do the family members have the opportunity at all in that 6 weeks to visit their loved one?
At this point, due to COVID, we have not had visiting. And at this point, we are starting to talk about it, but now we have this other variant. So it's postponing it a tad. We do, however, use WebEx. So the nice part is when my clinicians do a family session or the family therapist, we pull it's just like Zoom, but we use WebEx instead of Zoom, and they can see their loved ones. So it's like they're not fully disconnected, and they also will have an opportunity once per treatment stay, they do a WebEx with the family therapists, and they educate them. Then we follow up with sessions. Of course, with older adults, they are very tech savvy. People think they might not be, but they are. They love their cell phones. This is one of the few places you can have your cell phone 3 times a day. So they will do video chats. So they don't stay disconnected at all. They love to text people, and they love to, especially if they have grandchildren, they love to see what everybody's doing back home. So that's how they stay connected.
And not just a blessing for them, of course, but a blessing for the family members. Because if you encourage your loved one to come here and then you're concerned, well, it really seems like a nice place, but knowing that you might get a chance to have some communication, I think, and see the progress is just must be such a relief for the families. Well, I know we said we needed to keep this brief, so before we sign off, is there anything else that you wanted to make sure the audience hears about the program? And again, we'll have all the information, links, phone numbers, so all of you can reach out and get more information. But I want to give you the opportunity to close here.
I think what I would just say is don't postpone it. If someone's in need of treatment, there are people to answer your questions, people to alleviate your fears. I feel so proud of the team. We are all geared to older adult treatment now. We know what works and what doesn't work. All of our lectures are geared to that population. We do Life Worth Living, which is one of my favorite topics to give them. I do a thing on super aging because there is such a thing as super aging, which was a Harvard study. People don't have to age ungracefully. And I think it's never too late to, number one, develop an addiction, because some of these people were never addicted early on. And those factors I talked about fueled that. And I think it's never too late to get help. So the key is reaching out for help.
Okay, and that's, I think, the perfect way for us to end this with some positivity and some hope for the future. People can be very compromised, but they can still be helped. So thank you for taking the time to watch. We greatly appreciate it. Again, this is Erin Kershaw, and I'm here with Sharon Matthews, the Clinical Director of the Caron Treatment Center. Thank you.